OET Listening Part A, Extract 1. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes. This is official listening sample test of OET by Dr. Nasir.
Good morning, Mrs. Patel. Is that right?
Yes, that's me.
I'm Dr. Mark. Thank you for coming in. I understand you've had some problems with your legs. Can you tell me what's been happening?
Well, doctor, for the past 3 weeks, I've noticed swelling around both my ankles. At first, I thought it was just because I'd been standing too long at work, but then it didn't go away, even overnight.
I see. Has the swelling been painful?
Not really painful, more uncomfortable. My shoes feel tight, and by evening, my ankles look puffy. The left one is worse than the right.
And when did you first notice it?
About 3 weeks ago, but I remember feeling unusually short of breath climbing stairs a month before that. I didn't connect the two at the time.
That's useful information. Have you experienced chest pain or palpitations?
No chest pain, but sometimes my heart feels like it's racing, especially at night. I also wake up needing to catch my breath, so I've started sleeping propped up with 2 pillows.
That suggests fluid might be building up in your lungs at night. Any cough?
Yes, a dry cough. It's worse when I lie flat.
Okay. Let's go over your past medical history. Have you ever had high blood pressure, diabetes, or thyroid problems?
Yes, I was diagnosed with high blood pressure 10 years ago. I take amlodipine for that. My GP also mentioned my sugar levels were a bit high last year, but not high enough to call it diabetes.
And do you take any other regular medications?
Just the blood pressure tablets and some ibuprofen occasionally for knee pain.
Right. Ibuprofen can sometimes make swelling worse, but from your description, I'm more concerned about your heart. Any family history of heart or kidney disease?
My father died of heart failure in his 70s, and my mother has kidney problems.
That's important. Do you smoke or drink alcohol?
I've never smoked. I do drink wine, maybe 2 glasses most evenings.
Thank you. On examination today, your blood pressure is moderately raised, and I can hear crackles at the bases of your lungs. Your ankles are indeed swollen, with pitting edema. Putting this together, I think you have signs of congestive heart failure.
Oh, duh, that sounds frightening.
It can sound alarming, but with treatment, many people live well for years. Heart failure doesn't mean the heart has stopped. It means it isn't pumping blood as efficiently as it should.
What causes it?
There are several possible causes. In your case, long-standing high blood pressure is a strong risk factor as it makes the heart muscle work harder. Over time, the muscle thickens and becomes less efficient. The family history and perhaps the alcohol may also be contributing factors.
Can it be cured?
It can't usually be cured completely, but it can be managed. With the right combination of medication, lifestyle changes, and monitoring, we can significantly improve symptoms and quality of life. Many people live for decades with controlled heart failure.
What kind of medicines would I need?
We usually start with diuretics, often called water tablets, to help reduce the fluid buildup and swelling. We also use drugs that reduce the strain on the heart, such as ACE inhibitors and beta blockers. You're already on amlodipine, but we may adjust or add to that.
Will I have to stay on them forever?
Most likely, yes. But doses may change over time depending on how you respond.
What about my lifestyle?
That's equally important. I'd advise you to cut back your salt intake, as salt encourages fluid retention. Limit alcohol, as it can weaken the heart muscle. Try to maintain a healthy weight, and gentle, regular exercise like walking can help as long as you don't overexert.
I suppose I'll need to stop taking ibuprofen?
Yes, ideally. Non-steroidal anti-inflammatories like ibuprofen can worsen fluid retention and strain the kidneys. We can suggest alternatives for your knee pain.
All right.
I'll arrange some tests today. A chest x-ray, blood tests including kidney function, and an echocardiogram to look at your heart's pumping action.
Will I need to go into hospital?
Not immediately. If your symptoms suddenly get worse, say severe shortness of breath at rest or rapid weight gain, you should seek urgent care. But for now, outpatient treatment is appropriate.
And what about my prognosis?
Prognosis varies. With good adherence to treatment, many people live relatively normal lives. The key is recognizing early warning signs and sticking to the plan.
That's reassuring.
Do you have any questions or worries?
Just one. My father's decline was very quick once he was diagnosed. Does that mean the same will happen to me?
Not necessarily. Treatments have improved greatly in recent years. Everyone's case is different. Your father may not have had access to today's therapies.
That's good to know.
I'll also refer you to a cardiac rehabilitation program. It provides education, exercise sessions, and support.
That sounds useful.
Finally, we'll need regular follow-ups to check your weight, blood pressure, and symptoms. Keep a diary of how you're feeling. Note any swelling or breathlessness. That helps us adjust treatment quickly.
Okay, I can do that.
OET Listening Part A, Extract 2. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes. This is official listening sample test of OET by Dr. Nasir.
Good afternoon, Miss Harris. Is that correct?
Yes, that's me.
I'm Dr. Evans. Thanks for coming in. I see from the notes that you've been having headaches. Could you tell me more about what's been happening?
Well, doctor, for the past couple of months, I've been getting these severe headaches that come on suddenly. They usually start with this strange flickering in my vision, almost like shimmering zigzag lines. Then, about 20 minutes later, I get this throbbing pain on one side of my head.
Which side is affected?
Usually the right, though once or twice it's been on the left.
And how long do the headaches last?
Sometimes only a few hours, but more often it's the whole day. Paracetamol dulls it a little, but not much.
Do you notice any triggers?
Bright lights definitely make it worse, and strong smells like perfume. Once it came on after I skipped lunch, but other times I can't pinpoint anything.
Have you experienced nausea or vomiting with the headaches?
Yes, I often feel sick to my stomach. Twice I've actually vomited, which gave me temporary relief.
Any sensitivity to noise?
Oh yes, I need to lie down in a quiet, dark room.
Do you lose consciousness during these episodes?
No, never. But I sometimes get tingling in my fingers, almost like pins and needles.
That's important. Let's check your past medical history. Any previous head injuries or neurological problems?
None. I had mild asthma as a child, but that cleared up.
Do you take any regular medications?
Only the combined oral contraceptive pill. I also take ibuprofen when the pain is bad, though I know I probably take too many.
Any allergies?
Penicillin. I get a rash.
And family history?
My mother has migraines and my younger brother suffers from epilepsy.
That's useful. Do you smoke or drink alcohol?
I don't smoke. I drink wine socially, maybe once a week.
Thank you. On examination today, your neurological exam is normal, and your blood pressure is within the healthy range. From your description, these are very typical of migraine with aura.
I wondered if it was that, but I was worried it might be a brain tumour.
It's a common fear, but your symptoms are not suggestive of a tumor. Brain tumors usually cause persistent, worsening headaches, often worse in the morning and associated with vomiting on waking or neurological deficits. Your symptoms are episodic, linked with visual changes and nausea, much more consistent with migraine.
That's a relief.
Migraines can be unpleasant, but they're not usually life-threatening. The exact cause isn't fully understood, but it's thought to involve abnormal brain activity temporarily affecting nerve signals and blood vessels. Hormonal fluctuations, stress, irregular sleep, and diet are common triggers.
Does the pill make it worse?
For some women, yes. Combined contraceptives can increase the frequency of migraine with aura and slightly raise the risk of stroke. Given your history, we may need to discuss alternatives.
Oh, I didn't know that.
Prognosis is generally good. Many people learn to manage their migraines effectively with treatment and lifestyle adjustments. For some, frequency decreases with age, though in others it persists.
What treatment would I need?
We usually start with triptans, a class of medicines that can abort a migraine if taken early. We might also use anti-nausea drugs if sickness is severe. Preventive medicines, such as beta blockers, anticonvulsants, or certain antidepressants, are considered if attacks are frequent.
Would I need daily tablets?
Only if attacks are very frequent or disabling. From what you've said, you have several per month, so we'll consider it.
Are there risks with triptans?
They can cause tingling or flushing, but serious effects are rare. We'll assess your heart risk before prescribing.
All right.
Now, lifestyle makes a big difference. Keeping a headache diary to identify triggers is vital. Avoid skipping meals, stay hydrated, limit caffeine, and aim for regular sleep. Exercise like walking or swimming can help.
That seems manageable.
Also, try relaxation techniques. Stress is a powerful trigger. Yoga, meditation, or breathing exercises are useful.
Okay.
Avoid overusing painkillers. Taking ibuprofen too often can cause medication overuse headache, which mimics migraine but worsens with more tablets.
Oh, I didn't realize that.
We'll provide you with patient education materials and refer you to a migraine clinic if necessary.
Thank you, Doctor. I was really worried.